Hello, my name's Dev Lal, and I'm talking to my good friend and consultant orthopaedic surgeon, Jeremy Lytham. Jeremy, can you hear me?
Hearing you loud and clear, Dev. Good to see you again.
Jeremy Lytham is a consultant orthopaedic surgeon based in Winchester, and you've been dealing with, well, hip problems for many years, haven't you?
Yeah, Dev, I've been hip surgeon for over 20 years. I was a NHS specialist at Southampton General Hospital. I went into the private sector a few years ago and have been doing hip replacements, over 4,000 of them throughout my professional career. So all I do is hips. I don't do anything else. That's my speciality, and I love doing hip surgery.
Right, I was about to say, you don't get to do something like that often and that long without really loving it. So tremendous. What I wanted to ask you about, actually, and I was thinking earlier about my mum, who's getting a bit older and a bit more frail, and trying to get her to see somebody about these problems can be sometimes quite difficult. I mean, is that something you've noticed in patients? Because often it's a son or daughter that might bring their elderly relative in to see you.
That's often the case. You know, people put up with things for a long time, Dev. They don't want to trouble the doctor. They think they're making a fuss. And often, like, we're all human, we are worried. If we get pain and become disabled by it, we think, oh my goodness, is this something awful? And we're all reluctant to face up to things, and that's entirely understandable. It's human nature. But when things get on top of us, people start to notice that you're limping, you're having trouble getting around at home or getting out to the shops, playing with your grandchildren, then that's the time to seek advice. And the best way of doing that is to go and see your GP in the first place. But of course, people are very reluctant to trouble their GP, particularly at the moment with COVID, where it's difficult to get an appointment, understandably, social distancing, shielding. Many patients with arthritic hips have other medical problems. And of course, they've been shielding for months, and their confidence has been badly rocked by the pandemic. And that's something that we don't really talk about that much.
No, and I think that's a very, very valid point. But the other thing is, of course, that when you have, I don't know, when you find yourself maybe getting a bit slowing down, you're feeling a bit, you're starting to feel your years, then that also knocks your confidence, doesn't it?
Absolutely. I mean, as we get older, we start to lose, we have difficulty with balance, our muscles get a bit weaker, our bones get weaker, and people have eyesight problems, hearing problems, and all of these sensory inputs are hugely important in keeping us upright, confident, and not falling over. And of course, the risk of falling increases as we get older, and that rocks people's confidence. They don't want to go out of doors very much. Their social lives start to become much more inward looking rather than outward looking. And all of these things have a knock-on effect, which is a huge problem really for all of us as our society ages. And as you know, we are a society that is becoming older rather than younger.
As have you got any practical words of advice? I mean, imagine there's somebody watching this video, not me, but me, who has a relative that's, perhaps would benefit from seeing somebody like yourself, and they're reluctant to go. I mean, any words of practical advice to, how they might get granny or grandpa or mum or dad to come along?
Well, the best way of coming to see me, Dev, is to phone the office. The details will follow at the end of the video. Speak to Anne or Tracy in the office. They'll make an appointment for you or your relative to come and see me. I'll do a clinical assessment, find out how the pain affects you, when it started. I'll examine you to make sure it's the hip that's the problem. We can get some investigations like x-rays. Sometimes we need to do MRI scans, CT scans. That's pretty unusual. The vast majority of people with an arthritic hip can be diagnosed within half an hour, and we can make a proper plan to treat your condition. Now, that might just be taking painkillers, using a walking stick and slowing down, losing a bit of weight. But as often as not, by the time people come and see me, their arthritis has reached the point where nothing short of surgery is going to sort it out for them. And I can sit down with them and make a plan to sort out their hip as quickly as possible, get you back on your feet again, get you living your life and being out there again in the world, looking the world in the eye again, I call it.
But it's something you see all the time. You help people with all the time. It's not as if it's something rare or terrible or scary, and it's eminently treatable.
Total hip replacement surgery, one of the best operations in the history of surgery, Dev. There's over 110,000 a year done in the UK, the vast majority of which are extremely successful. It's one of the best operations ever. It's a lovely operation to do, and patients often wake up free of their terrible, debilitating arthritic pain. And within a few weeks, they're back living their lives again.
Excellent, excellent. Well, to anyone who's out there with a troublesome relative, or shall we say a relative who's reluctant to seek advice with painful hip, I think those are wise words there of reassurance, I think. So to end, I think, Jeremy, if you could just reiterate, how could somebody get in touch with you if they want to come and see you?
Best way to come and see me, Dev, is to phone the office. Details will follow at the end of this. Speak to the secretaries, Anne and Tracy. They'll make an appointment for you to be seen very quickly. Have a look at the website, lythamhipsurgery.co.uk. If you sign up to that, you'll be sent an email every day with some top tips and tricks, how to manage your arthritic symptoms, what to expect from surgery, and how to manage your rehabilitation. And then come and see me. Come and spend half an hour with me. We'll go through your condition and make a plan and share the decision making about what to do for the best for you.
Excellent, excellent. Wise words as usual. Thanks very much, Jeremy. Speak soon.
Thank you, Dev. Good to see you again.